I'm going to start off by introducing myself to the patient. So I'm telling my name, which is Stacy. I'm going to identify the patient. I can either ask them their name and compare it to the label in the lab requisition, or I could also do the identification number, which is also on the lab rec. And then I would tell the patient what we're going to do today. I'm going to draw lab. I'm going to do a clotting profile because the patient has a history of blood clots. I would make sure that they are fasting if that is needed for this procedure. I would assemble all of my equipment. I'm going to apply the tourniquet. Sir, this is going to be a little tight. And then I would palpate for the vein. And once I have found it, I would release the tourniquet. Just make sure it's not done, and then just leave it there. I would wash my hands, which I've already done. I'm going to apply my gloves. All right, then I'm going to tell the patient that I'm going to reapply the tourniquet. And I would do this 3 to 4 inches above the site that I'm going to insert the needle. And due to supplies, I would normally use a butterfly needle that has not been opened, and also the vacutainer, and then also the cotton ball, which I'm going to use this as a cotton ball. So I would clean my site in a circular motion, starting the insertion site and going out. I would let that dry. I would hook up all of my equipment if it wasn't already pre-assembled. And all I'd have to do is take this out of the package and then hook the vacutainer up. I've got my tube. So then I will palpate again. I will have my bevel up. I'm going to tell the patient there's going to be a poke. To insert I'm not going to move the needle around, but due to malfunction of the arm that we are using, the blood is not flowing, or the liquid is not flowing, but I would rotate the tube until it was filled. And then I would remove it, shake it a few times. I would take my cotton ball, lightly push it on there, draw my needle out, put it in a sharps container. I would hold pressure, remove the tourniquet prior. And then I could ask the patient to hold pressure while I grab my tape and my other gauze pad. I would check it. If there's still bleeding, I would apply pressure. If not, I'm going to apply the gauze pad with tape if they're not allergic to latex. My arm is slipping. I would tell the patient that if the bleeding has not stopped after 20 minutes, they need to apply pressure and elevate the arm on a pillow or above their head. If it still hasn't stopped, they need to come back in and to see us or see the doctor. Before I let the patient go, I would write the patient's name, identification number, and what we're drawing on the tube. And then I would remove my gloves, wash my hands, and then I would document all my stuff and let the patient go.